Ashley Crawford. I'm a speech-language pathologist by trade. APD stands for Auditory Processing Disorder, and the best definition that I have heard of APD is that it is what the brain does with what the ears hear. So someone who has APD may not actually have a hearing loss that can be caught on an audiogram, but might still feel like they are having difficulty hearing. A lot of like awareness, integration of the sound system again, and then retraining of the processing of those sounds. So like clinically, we could look at like decoding and then actual awareness and like processing of the sounds. As a speech-language pathologist who also has hearing loss and wears bilateral hearing aids, I really think about auditory processing from a little bit of a different perspective, because I also think about it as the development of phonological awareness and how we develop our sound systems. I have also actually gone through auditory processing intervention, and just that process has taught me so much and helped me, I think, provide the intervention better also. My hearing loss occurred when I was about 22, and so I remember what sounds are supposed to sound like. And when I think before the training, I was thinking about what something was supposed to sound like and trying to make it sound that way. And this training has also really showed me that it just might not be that way anymore. My hearing loss has changed the way that my brain needs to perceive sounds and how I specifically discriminate. And so really this program has taught me how to discriminate sounds differently, how to process them, and I think essentially it has rebuilt my phonological processing abilities from the ground up at the sound level, and that has made a huge difference in my ability to discriminate speech sounds, which is huge for both personal interactions in my day-to-day life, but also for my ability to provide good, efficient, and ethical treatment. Phonological awareness could be thought of as how the brain is interpreting the sounds, or how we're using those sounds in speech or language. If it is presenting in their speech, it could be perceived as just a speech deficit or a speech sound disorder. It could also be presented as or thought of to be dyslexia, or just difficulties with attention and attending, or even difficulties with learning, like a learning delay or something like that. Yeah, I think the symptoms of APD would be very similar to those of just straight hearing loss. And in fact, I think a lot of patients, adult patients, go to audiologists expecting that they have a hearing loss and are very surprised when their hearing loss might be within normal limits or not as poor as they thought it was due to their difficulties hearing. And so I think people who have APD are probably feeling very isolated, like they can't understand the people around them, like they can't interact. Eating in restaurants, going out, socializing is really, really difficult. And it can really be compounded by being told, well, your hearing is fine. And so that's even more isolating and can lead to a lot of just difficulties with socialization and withdrawal. Absolutely. I think an individual's primary relationship, either with a spouse, with any partners, with their children, with immediate family, as well as coworkers and friends, I think it can be significantly impacted, especially if people don't understand or are not willing to learn and meet that person halfway to try to help them communicate or help them interact. I think if somebody is looking for an answer for something that does not make sense and they have hit a wall over and over, and suddenly they hear, this could be auditory processing disorder. This could be something that we can treat and that we can help you with so that you can interact and you can have good quality of life. And there's something to be done. I think that changes the outlook significantly of somebody who is struggling. As a speech language pathologist, but also as someone who has a moderate to severe bilateral hearing loss, I think it's the best thing that you can do is to don't stop asking questions, find the answer, and participate in therapy. If that is recommended, it is going to make a huge difference.